Welcome to our May 2018 Ambassador Briefing. I'm so excited to have you guys on the line with us today, and we're going to chat all about our state and federal updates. It's wild, but our last briefing was before our Platinum Ambassador Assembly, so we've got lots of things to report back on and exciting news to share with all of you about our progress since then. If this is one of your first calls, my name is Julie Eller, and I am the manager of our grassroots advocacy programs here at the Arthritis Foundation. And it's my special job to help you all share your stories with members of Congress, elected officials, decision makers all across the nation. It's a great pleasure to get to work with all of you and also with our team. Michelle is on the line with me, Michelle Guadalupe, who is the Director of State Legislative Affairs, and she'll be helping to prepare or provide you all with a state legislative update later in the briefing. Let's start off today's call with a federal affairs update. So for our federal affairs, the last thing that we all got to do together was our Platinum Ambassador Assembly. We got to do our virtual assembly and have people participate from afar through social media campaigns to share their stories. And what we've seen so far is some really positive energy surrounding our legislative asks. So far, since the Platinum Ambassador Assembly, we have 8 new sponsors to our step therapy legislation. We also have 4 new sponsors for our pediatric rheumatology shortage legislation. And these are a direct result of the enthusiasm and passion that we all had in sharing our stories on Capitol Hill, either in person at the Platinum Ambassador Assembly or online through our virtual assembly. Thank you to everyone who participated. Another federal affairs update is a project that we have been working on with our advocates and with our ambassadors that you all should know a little bit about. It's our Accumulator Adjustment Programs awareness campaign. So accumulator adjustment programs are a new practice that are being used by insurers and PBMs to change how copayment assistance programs will work to contribute toward your deductible. We've been trying to raise awareness around what this might mean for patients through our Take Care blog, through our advocate webinar, and through our last ambassador activity, which was a Twitter chat, which garnered over 1.8 million impressions online. Thank you for raising awareness for these important policy changes and how they might impact patients. The next federal affairs update that we have is for our Patients Access to Treatment Act, which seeks to cap the copay for specialty medications, H.R. 2999. We've been looking to make sure that our grassroots advocacy efforts have been supplementing our federal activities, and so last month there was a Federal Hill Day where many different patient advocacy groups had individuals on Capitol Hill, and Vincent Pacilio, our Director of Federal Affairs, was able to join them for that day, and all of us were helping them raise awareness and beat the drum and provide a call to action for lawmakers by participating in our Patients Access to Treatment Act Action Alert, which we'll talk a little bit more about later on. Our last federal affairs updates are about how we've weighed in on administrative actions this past month, these past 2 months. As you might know, just 2 weeks ago, the Trump administration released the drug pricing blueprint with lots of proposed ideas and policy changes that have not gone into effect yet, but are seeking to someday help to mitigate the high cost of drugs and help to identify solutions across the drug supply chain. So we released a statement saying that we're cautiously optimistic about some of these policies and will be advocating for patients throughout to make sure that their voices are heard through this decision-making process. We also provided regulatory comments on short-term limited duration health plans, which are currently in the works from the administration to put them back into the marketplace. And something that was really special about these short-term limited duration health plans, or this action, was that it was the first time that we opened up a call to action to our ambassadors asking them to participate with us by providing comments to a regulatory agency. So usually our calls to action or our action alerts are sent directly to members of Congress. But in this case, we opened up a very short period of time where we could contact the Department of Health and Human Services directly to let them know some of the risks involved with short-term limited duration health plans. So thank you to those of you who took action. I don't know if you realized that it was a different type of action, that it was regulatory rather than legislative, but it was new, and if it's something that you participated in, it would be a great help to our team to hear about your experience and learn a little bit about whether or not you enjoyed weighing in on regulatory policy and if we should pursue that as an avenue again in the future. So if you did participate, you should expect to receive an email from me in the next week or so to kind of get your feedback and hear from you to see if we should continue down that path. With that, I know that those were some rapid-fire updates on federal affairs, but I'm going to pass it over to Michelle for some state affairs updates. Michelle?
All right. Thanks so much, Julie. Hi, everyone. So at the beginning of the call, we had mentioned that we do have a new State Director of Advocacy and Access. So this slide, what this shows is just a little bit about our team. So you can see who all is on it and where our new State Director, her name is Mary Bartlett, where she lies on our team map. We are super excited to have her. She just started on Monday, May 21st, and she has already met many of our volunteers at the Pennsylvania Capitol Day. She is going to be based in Albany, New York. So you can see that we've had some switching of some of our team members, but don't you worry. We will be all working together as a team as we do transition some of our staff in some of these new and different states. So if you get a chance, especially if Mary will be in your part of the country, just shoot her an email and just say welcome. I know that she will be in touch with so many of the folks in the Northeast and part of the Midwest, as she gets to know her states and gets to know all of you. So we're just really thrilled to have Mary as part of our team, and I know that you all will love getting to know her as well. We know the Out East is very, very busy with legislative activity, so we're excited to have another, some more boots on the ground for that part of the country. So I just want to kind of share this map with you, and like I said, it's definitely going to be a transition, and we will make sure that you all are kind of updated along the way, with our team members. So here are some updates for May. Hot off the presses at the end of last week, we have another victory, this time in Minnesota, and it's really due to our ambassadors that were involved with testimony, with some different media opportunities, but this is really, looking at curbing step therapy, and this is definitely a huge victory for all patients in victory. And guess what? This brings us to 18 state victories, and we actually have a number of states that are still in session, and we have a number of bills that are either on the governor's desk or getting close to being there. We've also been very busy. Staff have been sending letters of support for many of those bills that have turned into victories. And then many of you, I know, have gone on some of these different Capitol days. And that number, 233, is actually outdated, given that we just had our Pennsylvania Capitol Day yesterday, which I heard went fantastic with so many of you that were in attendance. And again, we've talked about testimony. This session alone, we had advocates testify over a dozen times in just state houses across the country. So just give yourselves, definitely a pat on the back. The reason why we've been so successful is because of all of you, and we just look forward to continuing to work with all of you, both at the state and federal levels.
Thanks so much, Michelle. That's perfect. And thanks always to our amazing advocates and ambassadors in the states who really worked so hard to make these 18 victories possible. here is a overall map of our victories this year, and you can see in 2018 we've had 18 victories in that dark navy blue color. So we're excited to watch this grow and grow, and it looks like we're on our road to 100 state legislative victories. So keep your eye on the prize. We're almost there, and we're excited to get there with all of you. So now I'm just going to give a quick grassroots update about some of the things that we've been working on since the Assembly. For me, the Assembly was an amazing opportunity to really get to connect with each of our Platinum Ambassadors and some of our people who are enrolled in or trying to become Platinum Ambassadors next year about new tools and resources that you might like to see coming down the pike. The best part of this opportunity was that I could really listen to what you wanted and think about ways that we could provide those resources. And I think that listening process is really what makes our program so special. And so as I talk about the next couple of things, I'm hoping that if one piques your interest, that you send me an email at jeller@arthritis.org to help become part of this planning process, because I'd love to send some of these proposals your way and hear back from you and see what really excites you, what works, and maybe what we need to think through differently, because this program is driven by you and your priorities, and I want it to be reflective of your needs as well. So the first new grassroots program that we're working on developing is an ambassador mentorship program, where we would take veteran ambassadors and do some brief training with them so that they could become fully masters of all of the different things that we do in advocacy. And then when we were to have a new mentor, or a new ambassador, sign up for the program, we would pair them with a mentor that could help guide them through the program, talk about why they could be doing different activities or how they can do them differently, and really help to strengthen that new ambassador process, that new ambassador recruitment process. So that's number one. Number two is that JA conferences, our juvenile arthritis conferences, are right around the corner, and we're working on building out our advocacy programming throughout. So if you're going to be attending a juvenile arthritis conference and you might want to help with the parent programming, or you have a child who might be part of one of these programs who's interested in helping out, or even if you have a really great lesson that you think would work well for all of the advocates and ambassadors, or the non-advocates and ambassadors who are new to the Arthritis Foundation, we can connect with them and put forward some of those lessons and great experiences that you have had. The next is our August recess planning. So as you may know, the Ambassador Program's cornerstone event is our August recess visits. During August recess, members of Congress return to their in-district offices in their home states so that they can connect with their constituents. And we are working on preparing what our legislative asks are going to be and the process by which we are connecting our volunteers with their meetings for this year. So if you're interested in being a liaison in your state and helping to coordinate the volunteer activities for maybe the ambassadors that live in your district, or even for the people who live in your state near a Senate office, we would be very, very happy if you would send me an email and kind of volunteer your time and energy and expertise so that we can make sure that that process goes as smoothly as possible and make sure that we are amplifying our efforts together for our August recess visits. And the last call to action that I have for you on grassroots activities for this summer, and what we learned from our ambassadors and attendees at the Platinum Ambassador Assembly, is that the ambassador website needs some work. So we're going to be doing some redesigning to strengthen our ambassador resources, make sure that you know how to navigate to see our agenda for when we're going to have our next call, where our ambassador activities live, how we can make sure we're reporting. And we're mocking a lot of this up and building content. So if there's something that you would love to see on our website, please send it my way. I want to hear your ideas, and I want to be able to help act on them. So if you are interested in helping, I am interested in listening. So please send me your ideas. I'm excited to work with all of you. So yes, a big part of what we talked about today were some of our progress this state legislative season and on the federal side since our Platinum Ambassador Assembly. And now I want to talk a little bit about how we can move forward this year and really use our tools that we currently have to help make Congress listen. So I want to talk to you a little bit about our Action Center and our action alerts. So if you log on to arthritis.org and enter into the advocacy section, so arthritis.org/advocacy, you can click into our Action Center. And as you know, our Action Center is a really great way to take action quickly. In our Action Center, we have pre-formatted messages that work well for each of you to just click send in 3 minutes or less and get a message to Capitol Hill or to your state legislatures about an access issue that people might be facing in your state. What we're hoping is that we can prepare letters that will really make an impact on our elected officials and on our decision makers. And so what we have been researching and hearing from our friends at Capitol Hill is that when we have an action alert that's a pre-formatted message, sometimes those messages are filtered out in inboxes on Capitol Hill. So if we all are sending an identical message, some offices have tools that they can filter those out because they think, okay, those are pre-formatted messages. Maybe they aren't truly coming from constituents. Now we know that if you're pressing send, they are coming from constituents. But we want to make sure that not only do we see a check mark that this message went through, it's on the Patients Access to Treatment Act in Congress, that it's getting caught in their filter, we want to make sure that we beat through the filter, that we can make that message heard. And so what I want to talk to you today about is ways that we can modify our messages simply by modifying a subject line or an opening paragraph, changing the signature, or embedding some of your story into the form letter itself will help your message get to the people who really need to hear it, the elected officials and their staff. So as ambassadors, I know that it's easy to go into our Action Center and click send on that 3 minutes or less action alert. But what I'm hoping that I can do now is empower each of you to take a few more minutes and change some of that message so that we can really make sure it's being read by the people who are receiving them. So what can we do? Well, we can understand the issue before we press send. And it's really easy to beat the filter by looking at why it's important to send this message and then incorporating our own story into a one-sentence line for the message. And so when you come to the Action Center, if you click Support Patients Access to Treatments Act, after you've clicked it, it'll bring you to this page. And you can read about the issue. You can understand that copay costs are very expensive and that we can help to cap them through this Patients Access to Treatments Act. And if I'm reading that, then I can think about my own patient experience and how expensive my biologic treatment was when I was growing up, and now, and how important it is for me to help limit that copay cost in this next letter. And so what I would do, I would scroll down into the message of my action alert body, and I would see this message on the left-hand part of our screen. So what you'll see is a subject line and a blank form where you can add in an opening comment for your message, a message body that is fully editable by you, and any closing remarks, and your custom signature. And I want to challenge all of our ambassadors on today's call to think about ways that they can start personalizing these messages. So if 3 minutes is all that you have, please keep pressing send. These messages are important and are incredibly useful to our members of Congress. But we can make them even louder by personalizing these messages. So if you personalize your message, if you have 5 minutes or less, here are my key tips. If you have 5 minutes or less, you can consider changing the subject line before you press send. Maybe instead of saying ensure patient access, cap the copay on specialty drugs, you could say something like, from your constituent, please cap the copay. You can change it just so that it's reflective of the fact that you are reaching out specifically to your member of Congress and that you are a constituent. And these can be very personal. They can be very short. You can keep the subject line, and maybe if you have 8 minutes to devote, maybe you could provide opening comments that introduce your own patient or caregiver experience. Simply by changing these or by adding in your opening comments, you are giving enough body to this email that it will break through that filter, land in someone's inbox, and when they open it up, it won't start with on behalf of the 54 million adults and nearly 300,000 children with arthritis, I urge you to support this bill. Maybe instead it'll say, Dear Senator, I have had arthritis since I was 7 years old, and because of my biologic medication, I am able not only to get out of bed in the morning, but I'm also able to run a mile or go to work or brush my teeth, whatever it is that might be for you, so that we can put your person behind the policy. We want these messages to be just as successful as maybe a drop-off is in legislator's office. You can put your person behind the policy and really make it real for them so that we can see the human face of what's happening. Okay, so let's say you have 10 minutes. You can change your subject line, you can add some opening comments, and maybe you could also add some closing comments. Just a quick thank you from a person who lives in your district, and you can maybe reference something in your community that your elected official will know and appreciate. So for me, when I grew up in New Jersey, if I walk into my representative's office, they always are going to hand out M&Ms, which are made in my district. So maybe I would say something to that end and say, you know, I'm eating some M&Ms today and thinking of all of the great work that we can do in our community. Now that's a little bit hokey, but you can identify some ways to create a personal connection between yourself as an important constituent and your community, just with 1 or 2 sentences. And seeing those things that can help make the experience more real between you and your elected official and their staff, you can create these connections that they will remember, that they might smile about, that they will see after you've beaten the filter. And so, if you have just another 5 more minutes, I might suggest taking some of those tools and integrating your message throughout the body here of the message that we have in our Action Center. Maybe instead of opening with your sentence, maybe I would add it into this paragraph and share some of your story immediately here. The really great thing about our action alerts is that each element of them is editable by you. And so you can really infuse your story throughout the whole message, which is exactly what we want. We want to be able to report this personal experience and share it with our elected officials and let them know that we are there as important members of their community, relying on them for help. The more human we can make these policies, the more human we can make our form letters, the stronger our connections can be. So again, if you only have 3 minutes, please just press send. But if you can spare 2 more, consider changing your subject line and modifying your message just a little bit, because just a slight modification will allow that message to really resonate with your elected officials and their staff. So that's our brief lesson today, and with our remaining minutes, I just want to go through our May and June activities very quickly. So for May and June, I want to encourage you all to attend your Walk to Cure Arthritis events. And as your activity this month, I am hoping that you will volunteer at the mission tent to help recruit new advocates and new ambassadors to our program. If you're looking to do something along those lines, please reach out to your local staff to offer your support. It's also this May. I realize we only have a few days left of May, but share your story this month to raise awareness for arthritis, because it is Arthritis Awareness Month. So we can raise our voices on social media, we can write op-eds, we can write letters. However you want to raise awareness this month, please do. my hope is that you'll practice sharing your story and putting a human face behind our policies and behind our experiences so people can really start to see arthritis in real life. And the last part is that we want to raise awareness for those accumulator adjustment programs by sharing our stories and sharing our resources. And there are a few ways that you can do that. We had a Twitter chat at the beginning of the month, and if you participated in that Twitter chat, then you can check the box and press submit on your Ambassador Reporting Center. But if you weren't able to join us, there are still ways that you can engage. I would hope that you could share our Take Care blog series online. Share it with your friends, send an email, include me on it. We want to make sure that people understand that there are changes being made by some insurers and some PBMs to how co-payment assistance might work for someone's plan, particularly in high deductible plans. So helping to raise awareness by sharing our blog or by sharing last month's advocate webinar, these are really great ways to help sound the alarm and help people become aware that these changes are coming down the pike. And those are our 3 activities for this month. But I also encourage you, if any of the activities that we talked about with our grassroots programs, our mentorship program, our JA conferences, our August recess planning, or our redesign of the Ambassador webpage, if those are of interest of you, please reach out to me directly at jeller@arthritis.org, where we can go through them together and share our stories and find out the best way to deliver some resources. With that, I'm going to open it up for any questions that you might have. If you have questions, you can type them into the chat feature, into the Q&A feature, or you can unmute your line by pressing #6 to ask these questions live. All right. With that, I'm going to end our ambassador call for today. If there are any new ambassadors on the line that would like to stay on for an ambassador orientation, we can get started with that in just a few moments. If not, have a wonderful Wednesday and a wonderful holiday weekend. Enjoy the long weekend, and I will talk with you all soon. Thank you so much, and have a great day.